Good evening, everyone, and welcome to the April 21st, 2021 Health and Human Services Board. And I will call the meeting to order. Roll call, please.
Kathy Leaf. Present. Kara Koch.
Present.
Dave Osnes. Present. Scotty Yard.
Present.
Greg Telejohn. Paulette Anderson.
Present.
Deb Lindeman.
Present.
Natasha Ward. Present. Paul McGinnis.
Present.
We have a quorum. Move on for approval of the minutes. Anyone seeing any additions or corrections? And Colleen, I do have one. We've got Scotty Yard was listed as absent. She was excused last month. So I'd ask if you would kindly change that one. Are there any other additions or corrections? Seeing none, with that one change, the minutes will stand.
She is marked as absent, but underneath it says excused absence Supervisor Ard in the notations underneath attendance.
Okay.
For voting, you have to list them as absent instead of excused for the voting in the IQM2 system. It's a voting issue in the IQM2 system, how we list them. So absent just means you're not going to have a vote recorded. When they're listed as excused, it does something different with the vote. So for the IQM2 system, they're just absent or present.
All right, I'm good with that. All right, we're going to move on. Public comment. Public comment's going to be 2 minutes long. We're going to go for 20 minutes. Is anybody wishing to, have you filled anything out? Anyone wishing to just make a public comment? Second time, anyone wishing to make a public comment? Have you got a card that you filled out? Okay, list your name and your address, please.
Jen Flanders, Wilson, Wisconsin. I'm mainly speaking because my son would like to speak but doesn't want to go first. So I was at a meeting, school board meeting this week of concerned parents who are done with masks. You've all seen the science, if that's where you want to go with it. Masks have no effect on a virus, otherwise we would be wearing them all our life. Otherwise, we'd be born without nostrils and without an orifice here. The masks are about control. You'd be better off to pump yourself full of vitamin D and zinc and all of that, and you all know that. And I'm standing here saying it for the public who's hopefully listening, and hopefully that they will stop listening to the propaganda. Being intubated doesn't do anything except kill you, and that was proven last April when they realized that people were dying because of having a tube stuck down their throat and into their lungs. It's time for the masks to go. There's no emergency. That's the only right you have, if you can even legally get that one to hold up. And we're done. We're done. You can take your masks and you can put them somewhere. We've had enough. I'll fill out a card for him too. Jump up here.
My name's Cole. I think it's dumb because we don't get see our friends. We don't get go to school without wearing a mask. It just, it's really, it just makes me feel like, yeah, basically that.
Say it out loud.
Basically a prisoner. Like we're slaves. It makes me feel like we're slaves. Because we don't get to see people without wearing a mask. We don't get to go to school without wearing a mask. Or go to the zoo. Or do anything without wearing a mask, hardly. It's like
Being a prisoner, right? Okay.
it's like we don't ever get to do anything without wearing a mask.
Do mask help?
No, masks do not help. What I said today, what they're good for, is making either a hammock for your toys or else making a slingshot. And I just think it is really dumb that we never get to see people without wearing a mask.
Hold the applause, please. Hold the applause.
Really? You guys get to applause.
Hold the applause, please, or we're going to be done with public comment.
Hi, my name's Elise Molter. I live at 1006 St. Croix Street North in North Hudson. I just want to say, I hope that everyone here just keeps doing their job. Their job is to advise us, inform us, and then let us all as Americans have a choice, especially when it comes to medical and private decisions. So I hope you guys will honor that, and I'm happy that our local Congress in Wisconsin found that the mask was unconstitutional by our state constitution. So I hope you guys will follow that as well and not make it a local county thing. And please just keep up with medical freedom, let people choose, keep it a private thing. If someone wants to wear a mask, that's their prerogative, and let it be a choice. So I just hope that you guys stick to what you guys are elected for, to inform and educate, but don't force anything. Keep us all free Americans, and just stay positive. We're all pretty tired of it either way, I'm pretty sure. We're not here to fight each other. We're here to fight the rules and the overstepping. That's what we're fighting. It's nothing personally against you guys or anything. Just hope that you can stick to your job roles and just educate and spread information and let people decide what they want to do with their own bodies, especially when it comes to children and things like that. Thank you.
Lynn Betzel, Roberts, Wisconsin, and nice hearing from the youth tonight. Thank you for that. Piggybacking on what the last lady just said about children's bodies and rights, I hope that Kelly will speak about communication that was sent out to the high schools about vaccinating 16 through 18-year-olds. Concerns about how that's going to take place, I hope that that will be transparent to the public and that parents will have full and complete knowledge of their child's vaccination. I am aware that in Eau Claire, they're putting pressure on the teens over the intercom to get their vaccinations. I really hope our ethical consciences will not allow that in our county, please. I've also heard from a lab worker secondhand that our cycles for the tests are at 40. Which result in a lot of incorrect results for the COVID. Hopefully Kelly will address or maybe tell us tonight how many cycles we test at. Also, I hope Ellie will report on just our county's deaths and hospitalizations instead of increasing the area that we report on. I believe it's misleading the public and creating more fear than there needs to be. Congratulations maybe are in place for Osnes, Leaf, and Lindemann, who have been reappointed to this board for 3 more years. I very much hope they will continue to respect public comment and allow us to maybe have a Zoom platform. And I hope that other people on this board, your silence is actually very telling. It means you're agreeing with things, you're not fighting for the people's rights, you're very silent. And according to the Board of Supervisors meeting, we're not supposed to mention names, so that person knows you're my supervisor and have not heard peep from you for at least half a year. Would appreciate you standing up for us and for the rights in the Constitution. Thank you.
Thank you. Anyone else? Anyone else wishing to speak? Last time. Anyone else wishing to speak?
Hi, Sarah Bachland, 573 Omaha Road. I just want to speak to the mask advisory that was put out. You know, after the state got rid of the mask mandate, we assumed that you guys were going to go through the process of getting a mask mandate yourself for the county, but instead just put out an advisory. And for most people, they don't know the difference, and I think you guys know that. Most people do not know the difference between a mask advisory, mask mandate, mask ordinance, and a law. They don't understand it. They just think that you put out a warning and that there is need for it. I think most people know that there is not a need for this anymore. Let the people choose what they want to do. I mean, I understand that we get to choose that, but there is a fear that gets pushed with any mask advisory, any mask mandate. You're putting fear into the people. A little child saw my bare face the other day and jumped and turned to their mother in fear. We are wrecking our kids. This needs to stop. There's so much more work we can do. But, I mean, what else do I have here? Someone shared about sharing information. That's your job, to advise. Please share more information from the other side. Actual health care, vitamin D. It's critical to whether you get the disease of COVID, Dr. McGinnis, or not. I haven't seen information being pushed on that. So, thank you.
Anyone else wishing to make a comment? Again, the second time, anyone else wishing to make a comment? And third time, anyone else wishing to make a comment? And we will move on to business item number 1, which is a COVID update.
Hi, thanks everyone for having us. For a COVID update, Ellie is going to share data. Oh, yep, there she is, and she's ready and she's on. And then we'll talk a little bit about masking, and I will address vaccine clinics in our high schools as well. I hadn't planned on that, but it seems like that needs to be addressed.
Thanks, Kelly, and thanks everyone for having me as well. I'm going to go ahead and share my screen and get started. All right, we are here for, yes, the COVID-19 and the vaccination updates today. Currently, whereas St. Croix County in terms of cases. St. Croix County, as you can see on the map of the entire state, is the darkest in color, as well as Polk above us and Burnett. That translates in meaning that we are at a very high case activity. And by case activity, I mean by the number of cases we're seeing on a daily basis. Out of the entire state, as of last week, we were the only county at very high. Now this has moved into Polk and Burnett counties. What you can see from the graph is our average daily cases are in that graph. You can see that spike we had in November. You can see how cases were on the decline. And then by the end of March, you can see that we have started an incline again. It is because of that incline that we are at a very high case level. We are currently seeing on average 29 new cases of COVID a day of St. Croix County residents into public health. Where are these cases happening? What this is a graph of is across time. So we're seeing the start of the kind of March 2020 up to April 21st. Now this is by episodes. So when someone began feeling sick, when their symptoms started. And if they were without symptoms, this is when their test was taken. One thing to note here, you can see cases between March and April, just the total number of cases. A lot of our older groups, especially our over 70 group there at the bottom, it's the brown line. They've had very low case numbers in March and the lowest case numbers now in April. Where we have seen an increase is actually in our 10 to 19-year-olds. Unfortunately, we are seeing a shift now to the younger age groups carrying more of the burden of COVID infection in our county. That green line there, that's the 10 to 19-year-olds, as well as the dark 20 to 29 and our 30 and our middle age ranges are also now carrying the most COVID disease in our county. In terms of what we're seeing from vaccinations from our Wisconsin Immunization Registry, we now have, of all of our St. Croix County residents, over 33,000 have had at least one dose, if it is a 2-dose series. And over 21,000 now, almost 22,000 residents are fully vaccinated, which is great. That number does continue to climb daily as vaccine clinics are held. Our 65 plus most vulnerable age group, we are seeing great numbers in terms of percentage of completed vaccination. As you can see, we have over 75%, over 10,000 are fully vaccinated. I'm going to pass it over to Kelly now to discuss our public health guidance, which, as you can see, as I mentioned, we're at very high. So we use our DHS, the Department of Health Services from Wisconsin. They determine what kind of our case activity is, and then we use that as our risk level to therefore guide and release guidance. Kelly?
Thanks, Ellie. Yes, so we put together advisory and guidance because we were getting a lot of people asking about, as we get closer and closer to summer months and festivals pop up and different activities that we all like to partake in and enjoy during the summer months. People are asking us and saying, what are the recommendations? Can we go forth with XYZ event in Glenwood City or Baldwin or whatever the case may be? I'm using those as total anecdotal examples, but we wanted to make sure that people have an idea of that. If you go back and look at Ellie's graph, and you don't need to go back, Ellie, but definitely this pandemic is not over. I don't know how to say that in a way that doesn't put fear into people, but we're just not there yet. We are struggling with cases every day, as you saw, 29 cases a day, and that we were there Ellie, Ellie, can you go back to the graph? Because I'd like to point out kind of where we were at, when we were hitting those 29. So as you can see, like at the end of December into January, probably mid-January, we are peaking back up to those kinds of numbers, which does put strain on our workforce, and it increases the risk of spread in the community when there are more cases. So I understand everyone is very tired. We are 14 months into this. We are tired. And I don't want this to be a fear-based education series, but we absolutely need people to know that this isn't over, and our numbers are spiking. The fact that we and Polk and Burnett County have the highest case activity in the state, that's not a good sign. So, okay, Ellie, if you want to go to the mask recommendation. So yes, so when the mask mandate was struck down, we absolutely said, as a team, what are the best next steps we can do? What should we do? We did not put out an order, and an order would be something that could be enforceable by law enforcement. We did not do that. We are advising people the best way to keep yourself and your loved ones who may have health conditions or other vulnerabilities safe is to wear a mask when you are with people outside of your household or in public. So this is an advisory. We know the science behind masks is reducing spread. I think the best piece that I have seen that I always go to and talk with our schools about is the fact that Wisconsin schools were cited for some of the best non-pharmaceutical interventions. We call them NPIs. It's a fancy word to say try to combat things without medication or medicine. So the state of Wisconsin was really looked at in their schools to say, we aren't seeing a ton of COVID spread within the schools. And why is that? Well, for one, kids are in masks. Kids are staying as best the school districts can, socially distanced. So we know those things do work at reducing spread. We know the most of our cases we are seeing are from either household contacts or somewhere in the community. So we will stand by the masking recommendation until June 6th. We will reevaluate it then. Again, it's not enforceable. It's just educational and a pretty darn easy thing to do. I understand not all people can wear masks, and that absolutely is something we understand in public health. Is this the last slide, Ellie?
Yes.
Okay, so I do want to address vaccinations in schools. So we have done influenza vaccine in schools for at least since I've been here, and longer before that, probably, I can't give you how many years, but every fall we survey kids or kids' parents, the guardians and parents, and say, hey, we are public health. We will be bringing flu vaccine into your child's school. Please fill out these forms ahead of time, and we'll get your kid vaccinated for flu. So we've been doing that. We are very used to running clinics like that. And since we are one of the only COVID vaccine providers that has Pfizer in St. Croix County, it's us and Hudson Physicians, we absolutely saw the opportunity to say to our schools, is this something you would be interested or want us to do? So we are making plans to make sure that kids, parents and guardians who want vaccine can get access to a COVID vaccine. It won't be part of the school day. We're holding the clinics right at the end of the school day, so kids don't have to miss class. They can get their vaccines. Ellie and I put together, in a matter of less than 48 hours, we put together a survey, and all the superintendents sent sent this survey out in all 6 districts to 16 and older, parents and guardians of 16 and older. The response rate was incredible. Over 1,000 people took that survey. So we have over 1,000 in St. Croix County, over 1,000 16 to maybe 19-year-olds, for sure 18. And I was very surprised. We usually plan for our flu clinics, we plan about for a 30% uptake in whatever population you target. So say we targeted K through 12 and there was 1,000 kids K through 12. We would plan that around 300 would potentially take the flu vaccine. We got, per our survey, close to, I think it was 65%. Ellie, you can correct me if I'm wrong. And maybe it was closer to 60 of parents and guardians said, yes, please vaccinate my kid with the COVID vaccine in the school. So, like I said, that wasn't supposed to be planned, but absolutely want to address people's concerns. We do have information related to vaccines on our website, so that's always a good place to go. And I guess we can entertain any questions the board has at this time.
Any questions or comments for Kelly or Ellie?
I had a question.
Go ahead, Kathy.
Are you seeing much variant activity in the county? I know that there was a report a few weeks ago about I can't remember which variant, there's too many.
Yeah.
Are we seeing that, and how effective are you hearing these vaccines are against the variants?
So I'll start off and Ellie can help patch any gaps. So yes, the variant was identified in St. Croix County. Man, time flies, maybe a month ago already, 3 weeks to a month. And it was the B117, which is the UK variant, that was identified. So we know that the state of Minnesota is genome sequencing. And what that means is that to identify the variant, you have to have levels detected of the virus hit a certain level before genome sequencing can take place, or there are other things that physicians and primary care providers should be looking for, such as reinfections. Like if somebody had COVID and is now sick with symptoms again, then they can ask free of charge that the State Lab of Hygiene sequence that so we can identify the variant. We do know that the state of Minnesota, I think, is up to over at least over 50% of their cases are variant right now. We are not doing a great ton of sequencing in the state of Wisconsin, and really that is at the direction of Dr. Westergaard, kind of the epidemiologist at the state level, who's the COVID czar, if you will. We are sequencing when people are testing positive and there's a level high enough that then they will be sequenced. I will say that the testing that started in Hudson last week Thursday and will continue through May at the highway shop, if there is an initial positive, all of those initial positive will be sequenced. So we will see, I think, in future weeks, if we are getting people testing positive at that site, we will be able to see how much variant we have. Ellie, what did I miss there?
No, it is true. Minnesota has declared that over 50%, about 60% of their cases are now due to the variant. And so what that tells us is what we're seeing with rising case levels is obviously that is coming into our area, into our county, which in part is a contribution to why our case levels are so high. We have had, like Kelly said, the variant was identified. And as I understand, the CDC and the Wisconsin DHS are working on, because of the amount of variant is increasing that they are finding, they're working on a plan of if they are or are not going to identify individual samples to the county for positivity for a variant. So we may not get exact numbers by our county in the future, And that just speaks to how widespread it is in the state.
And I don't think we answered your last question, Kathy, related to vaccine and how well that protects. I think there were a few initial studies that thought maybe the vaccine wasn't as effective against the variants, but I think that has been disproven. And what I'm hearing from state epidemiologists and people at the state level is we're still in a kind of a space where we're too early to tell. We are, I think there has been studies that say, yes, there is protection. There definitely is protection. How much protection and how much virus is detected in people, I think is still kind of up in the air, and time will help us with that. Ellie, do you have anything to add on that?
I would just say that of those cases, because obviously it is of great interest to individuals, of the vaccines that we do have currently on the market, they still have proven to be efficacious against death, hospitalization, and severe disease. So we are still seeing kind of the reason we are being vaccinated to prevent these poor outcomes. That is still a protection that the vaccine provides.
And then to stop the spread of the variants, the best advice would be to get vaccinated, right?
Yep. I'm going to pass over to Dr. McGinnis as well.
Yeah, I just wanted to reinforce two comments that Ellie and Kelly had made. First of all, there has been a change in the pattern of this virus that caught my attention when it started showing up in the younger population. And I think that represents either the presence of the variant, or it may represent that population has just become less cautious, or that there's some other factor going on. But it is a concern because so far we've been, things have gone pretty well, that population hasn't been, the younger population hasn't been as extensively involved. The really good news is there's lots of protection in our most vulnerable folks. That's great news. I think to Kathy's point, the information I'm seeing says that the Pfizer and Moderna vaccines, which are currently the ones being used in this country, are effective against the UK variant. I'll be specific on that. The question is are they as effective for mild disease? There's still some debate on that, but they're still really good. They're still way above that 50% threshold, at least in the studies that I've seen and looked at. And there's some pretty good data coming out of the United Kingdom that has been effective there too, even on a one-dose type of approach to vaccination, so they could get more people vaccinated. So I think you're exactly right that there is some significant advantage to continuing to be aggressive with vaccinating those who wish to be vaccinated and trying to slow this thing down in our community and to decrease the amount of spread.
Thank you.
Any other comments or questions? Bob, you want to add anything at this point?
No, Chair.
Okay.
Thank you.
Adam, anything?
No, Chair.
Okay. Thank you, Kelly and Ellie. You folks are doing a tremendous job, and you're putting in those long hours. We greatly appreciate all the good work you gals are doing, and staff. And again, please pass it on to everybody. You're the best of the best, and we can't thank you enough.
Thank you.
We'll move on to item number 2, public health permit fee schedule. Lori. Lori, are you there?
Yep, I'm popping up as Colleen. I don't have a camera on my computer, so I thought just in case you want to see my face, I would.
Okay, no problem.
So in your board packet this month, we tabled, last month we had brought forward, as we do each year, our license fee schedule for the environmental health licensing and inspection program. And so in your board packet, you have the 4 pages of the fee schedule. And just to refresh your memory, the items that are in yellow are the items that have changed. We made the decision to not do a across-the-board annual fee increase due to COVID, being sensitive to the economy for our businesses. But we were forced, and the reason we're bringing this to you is the Wisconsin Food Code changed, and so we had to update our fee schedule to align with the changes that happened on the state level for food facilities. So the middle column that has yellow items are name changes in the license categories. And then the yellow items on the right-hand side are those facility types that have had an impact in the license fee amount due to the changes of the Wisconsin Food Code. So again, the changes are due to the alignment with the Wisconsin Food Code. There is one adjustment in addition on the pre-inspection table, which is, I believe, the third page. Nope, the fourth page. Instead of having a different fee amount for a re-inspection fee for the various facility types, we have one across the board re-inspection fee amount for all the facilities, which you'll notice then for some it went down significantly. And then just to clarify again, those for the four types, for the four licenses that have a fee amount that has changed, if these fees are adopted, the existing businesses will not be impacted by these fee increases until July 1st of 2022. So it doesn't go into effect until next year for existing facilities, because at the next routine inspection that we do during this 2021 year, we're going to go through with each business type and do a license assessment to determine which license category they're in. So if they do have a change in their fee amount, they're going to have prior notice during this year, and it won't be implemented until July of 2022. New facilities that are licensed beginning July 1st of this year will go by this fee schedule if adopted. So at the last meeting, the subject of this fee schedule was tabled because there was a consideration of should we be even more sensitive to businesses due to COVID. And so the last 2 pages of your board packet, I put together some points that I think would be helpful to you. First of all, the state requires that all facilities under our agent contracts be licensed. We have no option to not license them. The licensing and inspection portion of environmental health is funded by the license fees. The fees are regularly evaluated so that there's no levy goes into this program. This program, we call that fee funded. We're not using taxpayer dollars to support the licensing and inspection portion of environmental health. Public health does not have the funds in our budget to eliminate or reduce the fees. There are 2.6 FTEs that work in environmental health, and approximately 65% of their time is supported by these fees from the licensing and inspection program. It's important to sustain this program because it provides important health and safety inspections in our community. In 2020, last year, when we ran the license renewals, we did provide facilities the option of not having to renew their license until October 30th. Normally, license fees are due July 1st, but we gave them an extension in case, they were struggling financially. I mean, some of the businesses were closed for a while, some of the license. So we gave them that additional time. Not all businesses have been impacted by COVID equally. We believe that, the business types that we license is anywhere from a Walmart to a small business owner. And so, I don't have data for every single business, but it's our prediction, as you could probably imagine, that not all businesses have been impacted equally by COVID. Department of Agriculture, since the last time we talked last month, I reached out to Department of Agriculture, which is the state agency that most of these facilities are covered under their agent contract with. And they were not aware of any jurisdiction that is eliminating or reducing their license fee structures due to COVID-19. And also, to the point about COVID relief funding, all of the COVID relief funding that public health has received or has been eligible for reimbursement to this point are specific for COVID expenses. The funding that we've received through the state for COVID, it has very specific identified things that we can request reimbursement for expenses. And eliminating or reducing license fees has not been listed as a potential reimbursable expense for the COVID-19 funding. The last thing that's showed on here is just to give you an idea of how much money the licensing and inspections program collects each year. So in 2018, it was around 193,000, 191, and in 2020, we collected 194,000. That second column, that state reimbursement, if you remember, we talked a little bit about that last month, where we're required to, from the 193,000 that we collect each year, we're required to send a portion of that back to the state. And so that total in that column is the reimbursement amount for each year that we reimbursed back to the state. So with that, those were the items that I thought might be helpful to you to understand. If there's any questions or discussion.
Anyone with questions or comments? Dr. McGinnis, I know you brought this up. Did this help you out at all?
It did tremendously, and Lori, thank you very much for taking the time and the energy to put this back together. And this does help understand me understand a little more about what's doable and not doable with these, and the fact that part of this is designed to fund the operations of that inspection. I totally agree with your fifth bullet on your first slide, which is it's important to sustain as it provides important health and safety inspections. Those are really critical. Food safety is a big deal. Environmental safety is a big deal. So from that standpoint, I'm well satisfied with what you've brought forward, and can support going ahead with the fees as discussed, since it sounds like the resources are elsewhere and not necessarily as available for this program, which needs to continue to fund itself.
Thank you. Anybody else?
Any other questions, comments? I think at this time we're going to be entertaining a motion to accept the public health permit fee schedule.
Mr. Chairman,
Yes,
I
ma'am.
would move to approve the public health permit fee schedule.
Is there a second?
I would second that.
Any further discussion? Seeing none, all in favor, say aye.
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 Opposed? Motion carries. Thank you. And thank you, Lori. Great job.
Yep.
Thank you.
We'll move on to our monthly financials. Faye, the lady with all our money.
Yeah, I'd like to spend your money. So, let me share my screen here. Okay. So I have the copy of our financials through March 31st of 2021. Just kind of looking at our comparison of March of last year to March of this year. Our revenues are very similar still at this point. Our payroll is up a little higher, and that's mainly due to the extra staff that we have in public health that we did not have, at the first part of 2020. Our operating expenses, again, are very similar to what they were at this time last year. You will notice in our 2020 column here that last month, I think this was still at a negative number. We did have a lot of our final CCS, Comprehensive Community Services money came in. So that brought our 2020 final numbers up a little bit higher. As I mentioned before, we still have some final reconciliation money coming from Children's Long-Term Support and Children's COP that we'll probably see in May. I didn't really have anything that to bring to your attention from most of the departments. As I said here in CCS, our money came in from last year. We're just starting to bring in our 2021, interim revenue that we get from our billing to medical assistance. Our purchase services, our CCS program is picking up, so we are seeing more services as we're providing, I guess just getting back to seeing more clients and being able to provide those face-to-face services that they need. In children's services, again, just to point out our purchase services, a little higher this year than at that time last year, but we did have some very high cost placements that ended, so we're hoping that's going to go down. They continue to strategize on ways to be working to keep children in the home and out of the high cost placements. And I think Bob has some comments that he will bring forward in his annual report. We did get some extra funding to help cover some of those from our sex trafficked youth. We got $88,000 that will help cover some of those placements. So here is our health center campus. Last month, because of the timing of the reports, all of the revenue wasn't posted. We do have all of our revenue through March included in our report this month. You'll see we're already behind from this time last year, and that's, so last year the nursing home was continuing to see people. Our census has dropped down. They are now, fully open to visitors. They're having, the hospitals are starting to do some of those short-term surgeries. So we're having people coming in for short-term rehab, knee replacements, hip replacements, and hopefully the census will continue to increase and we'll see that revenue coming back up. They have been adjusting staffing to coincide with the with the census in the nursing home. One of the things I wanted to point out is nursing home is continuing to purchase a lot of protective equipment, so the PPE, so they have gowns, they have N95 masks. You're going to see that here on this non-billable nursing supplies. So of this 50,000, 44,000 of that was specific to PPE, so personal protection equipment. Through some of the, either if funding becomes available specifically for the nursing home or through some of the county COVID money, we will be able to get reimbursement for some of those expenses because they're above and beyond what they would normally purchase. So currently the campus is showing like a $52,000 loss. Some of that will be captured or reimbursed through those expenses. The nursing home itself is at $21,000 at a loss. And then our last thing, we've got our veteran services, and they are very much right on track with where they were at this time last year. Part of we're still waiting on the one grant report. Once that comes in, they have very steady income and expenses. And then we have our purchase services graph, and this just shows you again where between behavioral health and CCS and children's services, where those purchase services are being spent. Those are the main driver that we affect our operating expenses. So any questions for me?
Mr. Witt?
Sorry, Fee, I got a tough one for you. It's good to see the Fund 225 is in the black as a total. At Public Health, we had quite a bit of state grants there that put public health into the black by quite a bit. Is some of that for 2021 expenses that are recorded as revenues in 2020? Is that one of the reconciliations that you need to do yet? Or is that all for 2020 expenses? So I'm looking at page.
So there is no more reconciliations for public health. All 2020 money has come in that would affect public health.
Okay. All right. So we got reimbursed for some planned expenses then within public health. So, all right.
Anyone
You
else?
want me to go back to there?
I think the key point of the financial report that Faye didn't highlight, but she should, is that HHS as a whole, the Fund 225 is in the black. So the last few years they've been in the red. So that's a big turnaround that we've gotten back into the black this year. And instead of using fund balance, we're actually putting fund balance back into the fund. So, you know, there are ups and downs throughout the cycle, but this is an up year. So I just wanted to note that for you. And thank you, Faye.
You're welcome.
And Faye, as a quick reminder for some of us, when we send some of our expense bills down to Madison, we're not reimbursed right away. There's up to 2 months or sometimes longer to be reimbursed. Is that correct?
Right. So for our state contracts, when we submit, you know, claims in March for February, we start seeing that money here in April. So I don't have the amount right here, but we had several $100,000 that we just received, you know, on April 5th. So we do our reporting through CARS, Community Reporting Center, and through Spark, and those get reimbursed to us on the 5th of each month. So yeah, January, most of our expenses go back to prior year. So February is when we kind of first start having expenses that we can claim. Those get sent to the state in March, and we receive reimbursement for them in April.
Thank you. Anyone else? Not seeing anyone. Faye, thank you very much. Keep up the good work, young lady. Your work
Thank
is
you.
greatly
Now,
appreciated.
here's the tricky is how the heck do I stop sharing? Okay. Thank you.
And we'll move on to our final item, our director's report. Bob.
Thank you, Mr. Chair. Good evening, everyone. I know there's a lot of attachments or material in your board packet, so I don't want that to scare you to make you think I'm going to talk for an hour. But I put together what I thought was an overview of some of the activities going on department-wide in HHS. The intention there was to inform you of activities, initiatives, and challenges that may assist you with policy decisions. So there were three basic things I was going to cover a little bit tonight. One was a legislative update, give you an idea of where we're at with the legislative process. Some of the key issues, as you can see in the board packet, are outlined in that Wisconsin County Association overview that was provided from Day at the Capitol. So you can, the intention there was for you to be able to look through some of those issues and get at least some of the talking points or some of the high-level kinds of issues that are popping up for HHS departments across the state, us included. Another item I was going to talk about this evening was leadership and personnel update. And the last thing was just to key in on a few things on the division updates that are provided in the board packet as well. So for each division, there's a few bullet points of things that are going on that I thought might be helpful for you to know about. If that sounds okay, I'll just go ahead and move forward. All right. Well, I have an announcement under the leadership personnel update that I don't really want to make. Julie Krings, our Children's Services Administrator and Operations Manager, has accepted a position with Pierce County as their Human Services Director. So Julie will be leaving us effective May 18th of this year. And that's a difficult thing for us to accept. It's probably an easier thing for Pierce County to accept. Julie has been a tremendous asset to our Health and Human Services Department, not just in the Children's Services Division or just in the operations capacity, but in general as a resource for our entire HHS staff, one of knowledge and one of leadership that we're going to miss. I am excited for her and this new opportunity, and again, just a bit saddened that she'll be leaving us in May 18th. But we are currently working with Julie and others on transition plans to fill that leadership position and make changes as appropriate. So I'll update you when I have more specifics about that. So, after that good news, let me provide a little update on the legislative session, at least in terms of what I know at this point. We've put together at HHS, this year it was an all virtual event. Day at the Capitol was virtual, so we all attended a 2-hour presentation from the Wisconsin County Association, and they did a really nice job of laying out the major issues that are affecting HHS or could in the governor's proposed budget. HHS directors were asked this year to put together legislative teams for their county, and we also, as a Western region, came together and decided to meet with legislators as a Western region as opposed to scheduling virtual sessions independently as counties. The reason for that was it was just hard to find the time slots for the legislators if we each individually tried to schedule those. So for St. Croix County, we have, as a part of this team, we have myself. For staff, we have Char Lopez, who's the behavioral health administrator, and Lisa Plunkett, who's the child support administrator. For board members, we have supervisors Fiedler, Anderson, and Chair Osnes on the team. So we have scheduled to date 4 sessions with state senators and representatives where we've covered the 6 main topic issues that WCA laid out for us. They include child welfare, behavioral health, youth justice, income maintenance, child support, and Birth to 3 program funding. Those are the 6 issue papers that the legislators received, and then we discussed our position on those as they pertain to the governor's proposed budget. I won't go into great detail. You can see in the board packet some of the talking points to each of those, but I would specify that one of my passions is to promote the idea of Wisconsin becoming a Medicaid expansion state. We're one of 12 states that are not Medicaid expansion states, which would raise the Medicaid eligibility to 138% of poverty, making more people, low-income or lower-income folks, eligible for health insurance through Medicaid. And this ties in with so many areas of our department, but it also would serve as a revenue source for the governor's budget that would allow for many of the items that we're asking for support in to be funded. And without that Medicaid expansion, the federal match that would come in, over $1 billion, federal dollars would come into the state to support Medicaid expansion. We could do a lot of good things with that in all areas of human services. But so that Medicaid expansion piece is a umbrella that we ask about when meeting with legislators and trying to get the temperature on where they're at with that. I think there's some, I don't want to say optimism, but there's some movement towards Medicaid expansion as a reasonable way to approach some of our some of our needs in the state for insuring people who can't afford health insurance but may not qualify for Medicaid. Again, I don't have a crystal ball for that. It's not looking great, but there's some hope at the end of the, or light at the end of the tunnel that maybe that will be considered in the end. Youth Justice has some interesting suggestions as a part of the governor's budget that include, I think philosophically, things that we agree with, but like moving 17-year-olds out of the adult correctional system to the children's system, and moving away from residential acute care settings for children and moving into community-based settings. We agree with, in general, those philosophies, but the start dates for those, or the effective dates for those policies to go into effect, or legislative changes to go into effect, are currently scheduled for July 1st of this year, which doesn't really allow counties enough time to build the infrastructure for community-based services. So we're pushing back a little bit on the effective date for some of that legislation, and asking that it be delayed till next year at least, while we make preparations for these changes. Counties weren't really included in the discussion around these legislative changes, so we were caught off guard this spring by them. Again, I won't go into great detail. I'll be happy to answer questions about these other topic areas quickly. The birth to 3 funding, our only issue with that really is that it's tied to lead poisoning, which isn't as much of an issue in our region of the state as it is maybe in, the more metropolitan areas. So we're asking that the issue of lead poisoning tied to the birth to 3 funding be removed, or that funding be more flexible in terms of how we spend it. Otherwise, we pretty much agree with the governor's budget and the proposed funding increases that go with it for the various areas of human services. One last thing I'd point out is in behavioral health, there was a change to Medicaid funding that allowed for residential substance use disorder treatment to be funded through Medicaid, which is good, but the room and board piece is not covered by Medicaid. So one of the proposals in the governor's budget was to pay for room and board through state funding as opposed to county funding or through the individual being billed for it. I think we have pretty good support from both sides of the aisle on items like that. So it might seem little to you, but they add up. And I think, again, the legislators are in agreement that that's something that would change. Lastly, on the legislative end, there's a separate Senate and companion bill in the Assembly for increasing bed capacity in Eau Claire for additional mental health crisis beds by 15, I believe. Or I could be wrong on that. It could be 20 beds at $15 million. But in any event, that separate legislation seems to have bipartisan support. The reason for that was to reduce the distance that law enforcement would have to travel when transporting someone for crisis care in currently going to Winnebago, and shorten that distance obviously for law enforcement, but also to reduce the stress and the trauma that consumers might experience in having to go those long distances in handcuffs or in a squad car. So there doesn't seem to be any pushback on that. It would be $15 million, I believe, from general revenue from the state. I'll stop there for a second. I hope I made sense on all of that, but if you have any questions or any specific comments you'd like to make, I could try and answer them.
Questions or comments from anyone? Concerns?
Then the last piece I would draw your attention to is the division updates and highlights in the board packet. I have to find them here. Just generally, I would say in Health and Human Services, we were hopeful that we would be able to bring back staff to do more in-person services, especially in the area of behavioral health. And we're still hopeful we can do that on a more limited scale, but we're really trying to navigate the pandemic right now with respect to safety. As of now, we're planning on a return to some in-person services through behavioral health in the month of May. And other divisions are also planning a return to some in-person activities like staff meetings or in-person services if they haven't been doing that before. Behavioral health is, like I said, one of the areas where there's probably the greatest need or the greatest opportunity to meet with people in person. Again, telehealth has been effective. I would say it's been surprisingly effective at helping folks, but I think what we want to do is look for that analysis of in-person services versus telehealth and how the two can be complementary and really enhance what we were doing pre-pandemic to reach people in a different way sometimes and to be more accommodating to people that can't travel. So I think we're wanting to bring back in-person service options for people starting in May, but also keep a close eye on how telehealth has been effective to date and not lose that as we transition back to in-person care. We also have to be thoughtful about how we space people out in group settings and that sort of thing, so we have space issues that come into play when talking about a return to in-person services. Each division's different, so each division has different needs, different requirements with respect to meeting people in person. The ADRC, Public Health, and I have been in discussions around that population and how to safely, how and when to safely reopen senior centers or respite services, and we're coming up with a plan for that, but we want to be again in sync with public health on how and when we do that, recognizing that many of our seniors are vaccinated and looking for that social interaction and needing that. So we're trying to be mindful of both things. Let's see. Oh, I did want to mention also under the healthcare center, this was late breaking news, but Sandy Hackenmuller let me know that she was nominated for leading age board director position, and she'll be meeting with Senators Baldwin and Johnson, I think next week to talk more about that, or maybe in early May. Sorry, Sandy, I jotted down notes right before I came. So everything else I've listed on here I thought were just informational, helpful for you to understand what's going on in each division. We remain open. The building's open from 8 to 4:30 every day, Monday through Friday, so to the public. So we haven't closed down during the pandemic. And it's important for people to know that if they have questions or want to come in and talk to someone. I think the last point I would make is that we've decided to have the economic support team remain working remotely. They seem to be effective in being able to do their work effectively remotely. What we would do then is make that change and free up the space that economic support was currently or previously using at the services center. It's in the hallway next to the behavioral health hallway. We decided to instead put the finance team in that hallway and give them a private sort of consolidated space to do their work where it's a little quieter maybe and where it makes more sense to me anyway to have them in a in one area and then free up some flex spaces and offices for the economic support or other staff to use in the main area of the services center. Okay, I'll be quiet and see if you have questions or anything you'd like to ask me. Or let me know too, please, if there are other things you would, another way to structure this or other things that you would like me to focus on when providing these reports. I think next month I'm giving the annual report for 2020, so we'll go into more detail and data at that. But for these sort of regular board updates, I'm open to your suggestions or what you would find helpful.
Greg, go ahead.
Me, I just joined, sorry. You had to point me out, didn't you?
Dr. McGinnis?
And just a comment back to Bob. It's a very delicate balance of walking that tightrope between being open and accessible and also meeting people face to face and in person with the trying to protect individuals, both those who are employed by the county and work with the county and those who also seek services. So I appreciate your efforts in trying to balance that out, and it's always going to be tough because it's never perfect, but I appreciate what you're trying to do.
Any other comments from you, sir? This wasn't too painful tonight, was it?
No, not too painful, but again, if you have suggestions for the kinds of information or the kinds of updates or a format in which you would like it presented going forward, feel free to email myself or Colleen and just let me know what would be helpful to you as board members. Thank you.
Well, and Bob and you and I had the comment not too long ago when you asked what I thought of a director's report, and I thought it went very, very well, and you did a good job tonight. So we look forward to seeing that each month, if you're all right with that.
Thank you, Mr. Chair. I think I was volunteering quarterly, if that's okay, unless there's something substantial, if that's okay with the board.
That'll be fine. We'll work on that one. How does that sound? Okay, with that, we'll move on. Are there any requests for any future agenda items from anyone?
Thank you, Mr. Chair. This is a potential request for a future agenda item. So for some time, I've been participating as a member of the a chamber business recovery committee since the COVID situation happened. And at our meeting last week, I became aware that the chamber also has a manufacturers roundtable, and they were going to talk about what was going on in Dane County related to affordable housing, particularly as it relates to folks that live in Dane County and maybe can't afford to live in that county, how they're addressing some of those affordable issues. I know that as a board, we have had this discussion in the past, somewhat related to the homeless situation in the county and how we might address that. And this is I see almost like another piece of that. There's, folks that are homeless or at risk for that, but also just people that work in our county that, have a hard time affording housing. I believe in December we had West Cap do a presentation and they talked about a housing study they did, but I'm getting around to it. My potential agenda item request is that I'm wondering, and I haven't had a chance to talk to staff yet because this roundtable was just today, but does the county have a housing study that we've done, like as a county-wide as a whole, to look at housing, not just from those at risk of being homeless, but from affordable housing perspective? And if not, is that something, that's my agenda item, that we maybe should consider if we don't have that? Now, at the roundtable, Polk County indicated, there were some folks from Polk County who indicated they did a housing study, I think an update in 2019, and it was around $75,000, but they got grants for a big portion of that. So my potential item is, should we look at having a housing study for folks living in the county?
Very good, Paulette.
And I do think West Cap does that. They just happen to be regional, which really works well in the housing. They would probably have numbers. It's how and they will tell you the issue. And I've heard Peter speak many times, is the funding isn't there in our state. Minnesota's a lot better about funding affordable housing. But we could do more studies. But I think West Cap has a lot of your numbers that you would want and would tell you why, what. I mean, she did give you some numbers, but there is no money. And they're doing housing. You know, there's one happening in Richmond now, and River Falls had one, and Hudson has had one, but he would do lots more if he could find the funding. But yeah, there is not enough affordable housing, absolutely.
Scotty, have you got a thought on this one by chance?
Mr. Chairman, so that this does not turn into a discussion because it is not an agenda item.
Oh, yeah.
We don't want to cross any lines.
Yeah.
What I'm going to say is I will pull data that I have available within my office and submit that for this agenda item discussion.
Okay.
Okay, that's fair enough. Anyone else?
Sorry I'm late to the party.
Go ahead, Greg.
Especially a short meeting, geez. But I had thoughts even before Care Talk, but tying into that, isn't there isn't there a survey, homeless survey done every year? Yeah. And if there was, what's the results of that?
It's not on the
Again,
agenda, so you can't talk about it.
Again, these are not agenda items. We cannot discuss this. I will pull those numbers and bring them. They will be part of the packet for the next meeting.
Okay.
I'm not asking for a question. I was just bringing that up as what I was thinking of also. I wasn't asking for an answer tonight.
We'll look at it, Greg, all right? And put it on the agenda. Thank you. Anyone else? Adam, you got anything you want to add? As long as we're down to the announcements?
No, Chair.
Okay. Ken, anything more? Seeing none, our next meeting will be May 29th at 5 p.m. Our meeting is adjourned. Thank you, and everybody be safe out there.